why Down syndrome patients develop Alzheimer disease at a much earlier age, usually by the age of 40 years, when normally people develop Alzheimer disease by after 65 years. That is a specific query which has been asked. To understand this, the first thing that you need to understand is that Alzheimer disease is a neurodegenerative disease. And neurodegenerative disease, as I mentioned also earlier, there will be a particular supervillain protein, the protein which is accumulating in the brain to cause degeneration of the neurons. One of the key supervillain protein which initiates and causes the development of neurodegeneration in a prototype neurodegenerative disease, Alzheimer disease, is beta amyloid. Now, the source of this abnormal beta amyloid protein is a gene, a particular gene. The name of that gene is APP gene. And the location of this APP gene, here comes the catch actually, the location of the APP gene is on chromosome number 21. Now normally people have 2 copies of chromosome 21. So they basically have 2 copies of APP gene. But Down syndrome patients have, it's a trisomy 21, Down syndrome is equal to. So Down syndrome patients have 3 copies of chromosome 21. So they also have 3 copies of this APP gene. And this extra gene dosage effect can produce enough amount of beta amyloid protein faster. That means if I ask you a simple basic arithmetic question of the standard 5, let's say I ask you this question, that there is a city, and in that city there are presence of 2 factories which are producing enough toxic product to toxify the environment in the city, and those 2 factories require 60 years to toxify the environment of the city, 60 years. In another similar city of size and shape, there are 3 factories present, and these 3 factories are also producing toxic substances. Now I ask you a basic arithmetic question, how many years it would be required to toxify the city, that other city, the second one, where there are 3 factories? So what would you do in a basic arithmetic? You think that 2 factories require 60 years, so 3 factories should require 2 by 3, 2/3 of the 60 is equal to 40 years. So arithmetically you can also understand why Down syndrome patients, they develop Alzheimer disease much earlier age, because Down syndrome patients, they have 3 copies of chromosome 21, they have extra 1 copy of chromosome number 21. So normal people have 2 copies, so they basically has 150% compared to a normal population, extra 50%, and these 3 copies of APP gene, they can produce this abnormal beta amyloid protein faster and at a faster rate, and they would take less time compared to a normal person who would be taking, let's say, 65 years, so they would be taking around 40 years. It can be proven even arithmetically. And that's why what happens in Alzheimer disease patients, Down syndrome patients, they start to develop the amyloid plaque development by the age of 40 years. Compared to normally, it usually starts only after 65 years. And the hidden catch here is that the APP gene, which produces that abnormal protein beta amyloid, which is a toxic protein, and the presence of that abnormal accumulation of that toxic protein in a form of amyloid plaque or neuritic plaque, that basically initiates and causes the development of Alzheimer disease, one of the key things actually. And so now you get the whole explanation that APP gene, which produces that beta amyloid protein, which actually causes, whose accumulation causes Down syndrome, that APP gene is located on chromosome 21, and Down syndrome patients has trisomy 21, so they have extra 1 copy of chromosome 21, so they have extra 1 factory to produce more amount of beta amyloid protein to cause the Alzheimer disease process faster. That is the whole explanation. Thank you so much.